Odds are you or someone you know suffers from asthma. It is a huge problem here in Fresno County that strikes 1 in 3 kids.
Tonight in our special Family Focus series, we continue with a look at childhood asthma and why it's important to treat it earlier rather than later.
Air quality, well, it's getting a little worse.
We see the reports, we know the facts. Central Valley air isn't always best, and that impacts even the tiniest among us.
We have started, I would say, 4 to 6 months.
Really?
Mm-hmm.
Asthma strikes 75,000 children in Fresno County, 1 in 3, even babies. Dr. Maurice Joseph of Community Hospital's Early Childhood Asthma Program sees many of them.
Okay, Brian, take deep breaths. Look here, Brian, like this. Breathe. Breathe. Good job.
It's a problem, she says, that often goes undiagnosed and under-recognized.
That's one of the biggest problems we have, diagnosing them early and putting them on the right treatment earlier on.
And as with most conditions, an early diagnosis is best.
A normal lung should look like this.
Fresno allergist Dr. A.M. Aminian showed us a model of how asthma constricts the bronchial tubes.
So you compare the two, so it's supposed to be this, and then it becomes, but it just turns out to be this.
And that long-term strain on a child's lungs can cause permanent damage.
Children, they need oxygen to grow for their normal physiology. If you don't provide enough oxygen to the body, the children's growth is going to be affected.
Breathe in and out, hold, perfect.
7-year-old Brian Alonso Garcia routinely visits Community Hospital's asthma clinic. This machine analyzes the nitric oxide in his exhaled air. A high level indicates inflammation.
There you go, 10. He's very well controlled.
What we're going to do is we're going to take like 2 puffs.
Brian uses an inhaler to keep his asthma in check. Dr. Joseph says ongoing treatment is often a challenge for kids and parents.
Education is a big component of asthma management. I mean, you may give the best medicine in the world, but what use if they don't take it?
It's not known why asthma strikes some and not others. Doctors say there's a genetic component. It often runs in families. Babies prone to viral infections or who've had RSV are at high risk. And there's the environment.
Starting from air pollutions to pollens, allergens, environmental tobacco smoke.
Managing asthma is key, and avoiding triggers when possible, so young lungs still developing can perform at their best.
And joining us now from the KC Newsroom is Dr. Kevin Hamilton, the director of the asthma program at a community health center. And Dr. Hamilton, thanks for being here. We're hearing that asthma rates in our area, maybe throughout the state, are going up. Why is this happening when we're doing so much to try to clean the air, especially here in the valley?
Well, the air pollution problem's been with us for a long time, and it's created a lot of chronic long-term problems in kids' lungs. What people need to realize is the short-term effects of air pollution are something that we notice in the coughing or the burning eyes or the runny nose that happens. But the long-term effects express themselves in swelling in our kids' lungs and damage to their lungs that can last for years and years, all the way into adulthood. Can actually affect the overall maturity of their lungs, so their lungs are smaller when they reach adulthood than other children. So it's important to recognize that this isn't a short-term impact, it's a long-term impact, and it's a result of a long-term problem.
When the lungs become damaged like that, can they regenerate themselves?
Well, that's not really known at this time. We're following groups of children in the LA Children's Study now for almost 15 years, and we're not really seeing that return to normalcy. What we're feeling right now is what you have when you're 19 or 20 years old is pretty much what you're stuck with for life.
And the best treatment still, we know that there are those inhalers, which are a type of steroid. Is that still the best way to treat asthma?
The best way to treat asthma is to get it diagnosed early and get people into a primary care provider, and followed by that primary care provider who's following the National Asthma Guidelines for treatment of asthma. And that is the absolute best thing that someone can do for their children.
All right. Thank you very much, Dr. Kevin Hamilton. We appreciate you joining us today.